My name is Molly. I'm a medical assistant at a dermatology office, and I'm here to talk to you today about skin cancer. Skin cancer is the most common type of cancer there is. Many people are not familiar with it. I know many people have all been, at the lake, at the beach, and hanging out with friends, and of course everyone's main goal is to get that tan. Whether people are using baby oil, suntan oil, some people even used castor oil in 30, 40 years ago. Little did we know that there would be risks in the future. According to the American Academy of Dermatology, 1 in 5 Americans will be diagnosed with a skin cancer in their life. Skin cancer can really change people's lives. People that are diagnosed with skin cancer, they have to be seen frequently for skin checks, for biopsies, having surgeries done. Some people, if they have more aggressive types, they have to be seen by specialists monthly and be constantly monitored. So it can really be a lot on someone when diagnosed with a skin cancer. I'm here to talk to you today to inform you about the types of skin cancer, treatments, and prevention. There are 3 main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. A good tool I used for research is Daryl Riggle's book, Cancer of the Skin. This was a good resource that helped me find out all about skin cancer and helped me a little bit more than I already know. Back to the types of skin cancer. Basal cell carcinomas, those are the most common, least aggressive types of skin cancer. Those typically do not spread to other parts of the body if treated. Basal cells are typically a non-healing wound that bleeds occasionally. Those are typically treated very easily. Squamous cell carcinomas, those are the second most common type of skin cancer. Those can spread to other parts of the body if not treated, and they can be more of an aggressive form. Melanomas are the deadliest type of skin cancer. Those can be very aggressive, spread to other organs, get to the bloodstream, get to the brain, and may require a lot more treatment. When looking for a melanoma or monitoring yourself, we like to refer to the A, B, C, D, and E's of melanoma. A stands for being asymmetric, meaning that your mole is asymmetric. It does not have any irregularity to it. B means border, making that it has an even border. C stands for color. Some melanomas, if not most melanomas, have a various different types of color in them. They can be pink, they can be brown, or have a combination of both. D stands for diameter. Diameter meaning it's larger than a pencil head eraser. That's something that we tell people to look out for if they have any large irregular moles. And E stands for evolving. Evolving meaning it's changing, progressing, getting bigger. This is a good brochure that we give to our patients at my work. It's a skin cancer brochure by the American Academy of Dermatology, and it's very helpful for patients that aren't sure what to look out for. They've never had a skin cancer before. Now we will get into treatment. Most common treatment is surgically removing the skin cancer. This is a surgical tray that we use daily in our office. Some instruments that we use on a surgical tray is a curette. A curette is kind of like an ice cream scoop. Typically it's used to scrape around a skin cancer and determine its borders or how involved it is. Next we have a scalpel here that's used to cut tissue. We also have 2 different types of, some people call them tweezers, but we call them forceps or pickups in our medical field. Another item we have here is our needle drivers. Those are used for suturing. Then we have scissors over here. Sometimes when they're removing skin cancers, they have to separate some tissue to get everything to close together nicely. We also have hemostats here. Those are used if we have any surgical bleeding going on. The doctor will use those to tie off a vessel. So they'll use that to clamp the vessel and tie off a vessel. Finally, we have our suture removal scissors. Those are used to trim any scissors or clip any scissors, any sutures during the surgery. Other types of treatment is a treatment called electrodesiccation and curettage. That's a treatment where they will also use this curette here. They'll scrape away the skin cancer and they won't have to have any sutures or anything like that. That usually gets people about a 94% cure rate. When doing a surgical excision, they remove the skin cancer, put in sutures, and then send tissue to a lab to have them check to confirm that they did completely remove the skin cancer. With that surgery, you are looking at about a 98% cure rate. Other options for treatment are radiation, chemotherapy, topical creams, depending on how involved the skin cancer is. Now we get to our prevention. How to prevent skin cancer. One thing is limiting your sun exposure. With a recent interview that I did with a physician assistant, Adam Payne, at a dermatology office, he says that avoiding the sun completely is not realistic. One thing that you can do, and that's always the most common, is using sunscreen. Sunscreen, he recommends 30 SPF or higher. You should be reapplying it every 2 to 3 hours or so. Another item that you can use for protection is wearing a wide-brimmed hat. That will protect your nose and your ears. And also using sun protective clothing. So they make SPF clothing that's used specifically, that's also comfortable, but does protect you from the sun. Another way for prevention is seeing your dermatologist or seeing your primary care doctor and having them do skin checks, looking at your body to see if you have any unusual lesions and just keeping a close eye on you. So in conclusion, I understand I work in dermatology and this is a very comfortable subject for me to discuss, something I'm very knowledgeable in, but I know that not everybody is familiar with skin cancer, and when hearing the word cancer can always be scary, can always be alarming. We're always thinking worst case scenario. I really just want to take this to inform other people about skin cancer, so that way, if they know someone that's been diagnosed, or they've been diagnosed with skin cancer, or they're just wanting to prevent themselves in the future, it really just helps them become a little bit more knowledgeable about it and not be so fearful of skin cancer. So thank you for your time today, and I hope that I informed you of skin cancer. Thank you.